Dr. Nathan Thompson here, author of Transformation 28 and creator of the T28 Challenge, here today with your 5-minute food for thought. Now today is about how to overcome perhaps one of the most nagging and irritating injuries out there in runners and in athletes and in CrossFitters. It's called plantar fasciitis. Now plantar fasciitis is when the fascia or the band of connective tissue on the bottom of the foot gets stretched or torn and becomes inflamed. Now people who have this often complain of a sharp stabbing pain either on the inside arch of the foot or at the bottom of the heel, particularly in the morning when they get out of bed or if they've been sitting for long periods of time. Now as this progresses, many people will also notice pain that starts to form in the back of the heel, and they also may get some swelling and tightness in their Achilles tendon going all the way up into the calf. Now by the way, those symptoms I just described with the Achilles tendon and the back of the calf, this is actually a common symptom in kids, and this is not a symptom of growing pains. This is a sign of a problem that's going on. Now, many times when someone goes to their medical doctor, they may prescribe cortisone shots and a walking boot. And while this may help with inflammation, it still won't address the causes as to why you got it in the first place. So let's talk about how to get to the cause and find a permanent solution, not a short-term Band-Aid. So here are 4 things that you can do to help with plantar fasciitis and help it heal naturally without drugs or without surgery. Now, I want you to make sure that you watch to the very end because I'm going to give you a tip that you can start doing today. Half of all people with plantar fasciitis do that make their condition worse if you watch to the end. So here's reason number 1, or solution number 1. Correct the structure of the foot. Look, if you hit a pothole in your car and you knock the wheel out of alignment, it will wear down quicker than all the other tires. So would the solution be just to put on a new tire? Of course not. You need to fix the alignment first. And most times the number 1 cause of plantar fasciitis is a flattened arch, otherwise known as pronation. And when that arch flattens in the foot, the fascia is going to get stretched and inflamed every time you take a step while running or jogging, or every time you land when jumping rope or doing things like box jumps. Specific chiropractic adjustments to the feet, the knees, and the lower back will help restore motion and alignment back to the foot, allowing that fascia to be able to relax and begin to heal. Now, it's important to find a practitioner or a chiropractor who is skilled in extremity adjustments. Now, you have a quarter of your skeleton located just in your feet, so it's important to find someone who actually knows what they're doing. Now, reason number 2, or correction number 2, is correct the soft tissue. Now, a side effect of having a flattened arch is that there tends to be a lot of scar tissue that's going to build up over time, even before you have any kind of symptoms. And scar tissue, if you look at it, is way less flexible than normal healthy tissue. And what you have to do is you have to reorganize that scarring so that the foot can begin moving correctly. And I recommend how doing this is using 3 different methods. The first method to do to help with the soft tissue is called rapid release. Now this is something that is very new, but I found is really, really effective. In fact, I use it actually on myself 2 to 3 times a week because I tend to beat myself up a little bit with exercising that can produce a lot of scar tissue. Now what this rapid release does is that it induces a vibration into the scar tissue to help break down this inflexible tissue. Now, the second thing you can do to help with scar tissue is static stretching. And you have to do static stretching for 2 minutes at a time. Now, most people when they're stretching for plantar fasciitis, they're only targeting the big calf muscle known as the gastrocnemius, but actually it's the Achilles and the soleus muscles that are to blame. One great stretch that I love to do because I have suffered too with plantar fasciitis is called the pistol stretch. And this is a great stretch to target the Achilles tendon and begin lengthening it so that it doesn't pull on the heel and eventually the plantar fascia. And the third thing you can do is called a crossball mobilization. Now this is easily done by standing on a lacrosse ball, finding tight and tender fibers in that fascia, flex and extend your toes. Now, word of caution, it may be very, very painful, and that's why my patients do it while standing on a vibration platform. That helps to block the pain signals going back to the brain, and you actually get a lot faster response because you'll be able to do it a lot more aggressively. Now, the third thing that you can do for plantar fasciitis, and reason number 3, is to support the foot with a flexible custom orthotic. Now the feet are bearing all of your weight, so it can be really, really difficult to correct the foot unless the feet are in optimal position for at least 80% of your day. And since the foot is designed to be flexible, the orthotic that you're getting should not be hard and rigid. And since every foot is different, a store-bought generic orthotic most likely will not work, since they only provide a few options for you. Now, sometimes you can catch lightning in a bottle, and they can work for a small percentage of the population. And the fourth thing that you can do too is take liquid magnesium. Now, magnesium serves numerous functions inside the body. One of them is to relax smooth muscle and fascia. So this is also true for people with runner's knee or for IT band syndrome. Now, most people, especially people who exercise a lot, can cause a lot of issues with body parts that contain a lot of connective tissue, including the feet. So you want to take at least 400 to 500 milligrams per day of liquid magnesium citrate, and oftentimes people can double that to help them get better faster. Now, just a quick word of caution: if you find yourself running to the bathroom every time you take magnesium, drop the dosage just a little bit. Now, on to your last tip. And this is something that you can start doing right now. Untuck your sheets at night when you sleep. That's it. Now, if you're someone who sleeps with the sheets tucked into the bed, it forces your foot into a position that shortens your Achilles and your plantar fascia. So this is a reason why your foot hurts so much when you wake up in the morning. Now, of course, this isn't a fix, but it's just one thing that you can do to help you on your road to recovery. So remember, fix the alignment, fix the soft tissue, support healing with a flexible, customized orthotic, take liquid magnesium, and untuck those sheets at night. Hey, this is your 5-minute food for thought. Make sure you like this, and more importantly, share this with someone who needs a solution to plantar fasciitis without drugs and without surgery. If you have a question, leave it in the comments below. And if you need help, schedule a consultation with me in the link provided. Here's to a better you, and we'll see you soon.